Hello and welcome to this special Virginia Opioid Abatement Authority session for the Virginia League of Social Services Executives. My name is Jennifer Nelson, Virginia Institute of Government, Assistant Director for Membership and Engagement. The Virginia Institute of Government is the leadership development and community engagement arm of the Weldon Cooper Center for Public Service at the University of Virginia. Through our research, leadership development programs, and local government engagement initiatives, we continue to work toward our vision of good governance, equity, and resilience in every Virginia community. VIG offers leadership development through SEI and LEAD, local government equity clinics, certification for treasurers and commissioners of the revenue, and customized training programs. State agencies and local governments can access a range of consultation and support services to build more resilient organizations. We have a team of seasoned public sector leaders and subject matter experts ready and available to facilitate boards of supervisors, city and town councils, leadership teams, strategic planning retreats, and other related events. Today, VIG is glad to partner with the Opioid Abatement Authority for this special VLSSE program. Here are a few housekeeping notes. This session will be recorded and posted on Weldon Cooper Center for Public Service YouTube channel soon. I will send a follow-up email with a video link to all those who registered. If you have any questions, please feel free to unmute yourself and ask. Should you prefer to type the question into chat, I can ask them for you. Thanks again for taking the time to join us today. Now I'm happy to turn things over to Tony McDowell, the Authority's Executive Director. Tony?
Thanks, Jennifer, and thank you to Virginia Institute for Government for providing the back-end support and co-hosting this event. Good afternoon, everyone. My name is Tony. I'm the Executive Director of the OAA. You may have seen me at the conference, the Virginia League of Social Services Executives Conference that was held in was it in Lynchburg? I think it was in Lynchburg in November. There was a number of folks in the room when I had the chance to present at that event. And one of the common themes during the Q&A is that the OAA needs to make this information more widely available to other DSS offices. And so really the purpose of this is to follow up on that presentation. I spoke with Rebecca Morgan and her role as the president of the league, and she offered to work with us to set up this webinar. And so we have taken some of the general presentation materials that we have for our general audiences and tried to really kind of hone in on what all this information means for local Department of Social Services offices. And the bottom line is this: you guys should be applying for Opioid Abatement Authority grants. We have money and we're here to give it away for the right reasons, for the right purposes. And there's a number of areas where I honestly believe that the funding we have available can be used in DSS to not only help people and keep families together, but to really advance public safety and public health in the Commonwealth of Virginia. So with that, I'm going to jump right into the presentation. The total amount of settlement funds that the Commonwealth of Virginia expects to receive over the life of these settlements, which is an 18-year period of time, is $1.1 billion. Which is a really big number. We've already received the first 3 years of payments, which means that we have 15 more years to go. Now, where are these payments coming from? Unlike the tobacco settlement, which was one settlement, we're tracking multiple different settlements against multiple different companies at the national level. The ones that have been completely finalized and have started making payments into Virginia include the ones that you see on the screen here. The first three, we call them the distributors. These are the three largest pharmaceutical distributors in America: McKesson, AmerisourceBergen, and Cardinal Health. This is the settlement that made the biggest sort of splash in the news a couple years ago, because that settlement's worth up to $21 billion nationwide. And it's the one that has 18 years of length to the term. But all of those have been settled, and those companies have made the first 3 years of payments to Virginia. And so each of your localities have already received 3 years of payments from those companies. And I'll talk a little bit more about that in just a moment. The other company that we have settled with and has started making payments to Virginia is Janssen, which is the pharmaceutical arm of Johnson & Johnson. But as I mentioned, there are other companies that are still going through the process of finalizing either settlements or bankruptcy negotiations. All the ones on the left side of your screen are the agreements have been signed, sealed, delivered. For the most part, court approved. There's some of these we're still waiting for a Virginia court to put the final ribbon on the prize, so to speak. But these are all more or less finalized, and there's some legal steps that the state's going through to get them finally executed. But they include some pretty big names. You see on here, Walmart, CVS, Walgreens, Kroger, Allergan, Teva. And then the bankruptcy cases, they tend to be a little bit harder to predict. Mallinckrodt actually just made their second and final payment to Virginia. Indo and Purdue are still going through litigation. Purdue's being heard by the Supreme Court because there's been challenges to that bankruptcy because it protects the Sackler family members personally. And so there are some states' attorneys general that take issue with that. And so the Supreme Court is slated to be hearing that case in their current term. But the purpose of this is just to give you a sense that it's not just one settlement that we're dealing with. There are multiple different settlements. As these settlements started to come to fruition at the national level, it became apparent to Virginia that we would need to receive and distribute these funds. The General Assembly created at that time the Opioid Abatement Authority as an independent entity. So we're a state agency, but we're not part of the administration. We're truly independent. We report to a board of directors. I've listed their names here. But because we're independent, we're exempt from the state's procurement laws. We're exempt from the Personnel Act, which means that myself and the other employees of the Opioid Abatement Authority, we serve at the pleasure of the board. So if they're not happy with the work that we're doing, then they can just tell us we don't have to come in tomorrow. We have no access to any kind of civil service protection or grievance procedure. But all of this is by design. It's because we don't want to be a bureaucracy. We want to operate lean and mean. We want to be efficient. We want to do whatever it takes to help you and other representatives of the human services field that work for cities and counties. We want to help you make the most of the opportunity that we have with these opioid settlement funds. And so the key here is that even though the governor appoints this board, the law is very clear about limiting who he can appoint. Each person on the board fills a statutory defined role in terms of representing a particular industry or a particular stakeholder group. We have one representative from the Senate, one representative from the House of Delegates. We have one representative from the administration. We have two representatives of community services boards. We have a representative of Virginia sheriffs. We have two addiction medicine specialists, and we have representative of the recovery community. And so each of these folks are experts in their field, and 8 of the 11 are by code non-legislative, non-political appointees. And so we're not like a lot of state boards, commissions, and authorities that are sort of political animals. We're truly bipartisan and apolitical. And what that does for Virginia that I haven't found another state yet that has it is it gives us the ability to really, we exist for no purpose other than to help you receive and use these funds. And that's, I mean, this is all we do. Every day we think about grants and how to help cities and counties and state agencies apply for and use these grants for the purposes they were intended. And a housekeeping idea just came into my head. I'm sorry, I'm breaking out of order here. If you have a question or something doesn't make sense, please feel free to just unmute and throw your question out there. This is very informal. If you don't want to do that, type it in the chat and Jennifer will catch it. All right, so a little bit about how the funds are distributed across the state when they come in. So anytime a dollar from any one of these companies comes to Virginia, whether it's a settlement or a bankruptcy, it goes into this pie, and 15% goes directly to the state, where the governor and the General Assembly can appropriate those funds for opioid-related purposes. And so we, the Opioid Abatement Authority, we don't have anything to do with this. This is where the governor proposes how the funds are going to be used, and the General Assembly debates it, and while they're in session, and then the budget gets passed, and the funds get used. But it's important to know that within this share, these funds can only be used on approved opioid-related expenditures. So they're separated from the state's general fund. And this is a really great opportunity for the state to make new state level investments in opioid abatement remediation purposes. 30% of the money coming to Virginia goes directly to our 133 cities and counties. And so each city and each county in Virginia is a plaintiff in this lawsuit. They all have legal standing in the courts. And for that reason, they get a cut right off the top. Each one of you who works for a city or for a county, every city, every county in Virginia has received payments directly from the court-appointed settlement administrator that reflect settlement payments from the companies that have finalized their cases with Virginia. There are restrictions on how these funds can be used, and the restrictions are different for each one of the settlements. Remember, I mentioned that each one of those companies has its own settlement agreement. We'll talk about this more in a minute, but this is not just free and clear money that can go into the general fund. There are specific requirements attached to the use of these funds. And in short, they need to be spent on opioid abatement remediation purposes. And then 55% of any of the funds that come to Virginia come to the Opioid Abatement Authority. And then our whole purpose, our whole meaning in life is to give grants. So we take these funds and we provide grants to cities and counties, to individual cities and counties. We give grants to partnerships where you have multiple cities or counties working together. We give grants to state agencies. And then we have an unrestricted fund that allows us some flexibility in providing additional grants to these same potential recipients. But a key issue is we can only give money by law to cities, counties, and state agencies. And so we can't give money to community services boards. We can't give money to regional jails, even though those are public bodies that are governed by people that are appointed by local government officials. A regional jail is not a city. All right, a community services board is not a county government. And so we can only give funds to county governments and city councils. So if your DSS agency is interested in applying for a grant, you have to do it through the umbrella and through the fiscal agency of your city or your county that you're connected with. Anybody have any questions on that before we proceed?
Tony, this is Gretchen. This is Gretchen real quick. So
Hey,
just to
Gretchen.
clarify, hi, Tony. We can access money two ways. One is directly through the money that was given to our city or county and however they've set that up, or one is directly through our city or county through this other pot of money, the 55% that OAA is in charge of.
Right. So you guys could, and Gretchen's with Henrico, you could approach the Henrico County manager, Henrico board, and say, hey, we have an idea for how Henrico County should spend some of the money that it's gotten directly. Okay. You could also go to those same folks, your county administration or your board of supervisors, and say, hey, we think that our county or our city should apply for one of these grants. And here's what our DSS office would do with the money if the county or the city receives the grant. But the key for DSS executives is to understand that the application has to be signed by whoever your elected body, not your DSS, not your DSS board, but by your board of supervisors, city council, usually gives signatory authority to a city manager or a county administrator to apply for grants. So that's the level of signatory authority that you would need in order to submit a grant to the OAA. In other words, Gretchen could not submit an application directly to the OAA. It would have to go through Henrico County. Does that help?
Thank you. Yeah, it sure does. I just want to make sure that got clarified.
Perfect. Thanks. Okay, so this is where sometimes I lose people a little bit. Let me go back to the pie. We have to, the word we use to talk about the money that goes directly to the cities and counties is your direct share, okay? Which is separate from the individual grants that you can apply for. So when we talk about direct shares, each city and each county has to be careful about how they spend those money. The OAA does not, we're not able to see how you're spending the money that goes directly to you from these companies. And so your city, your county finance accounting office has to keep track of those monies, or else your city, your county could really get in hot water with the courts. Okay. And it's because each settlement is slightly different, I can't tell you exactly what the rules are because the rules are different for each one. And enforcement and reporting under those agreements is extremely unclear. The first big settlement that came to Virginia was from those distributors. That one settlement is 600 pages long. And I've read most of it, and I couldn't follow it. Like, it's extremely complicated. If there's any disputes about whether or not you followed the rules or not, it's not handled. This is not state money or federal money. This is all money that's been awarded through a civil action. So the defendant companies could sue your city or county or take you back to court. In Richmond Circuit Court would be the venue. So you'd have to come to City of Richmond in the circuit court and defend your actions in civil court against those companies. And so that means that all 133 cities and counties have this burden. But if just one county is found to have violated the agreement, it kind of puts all the cities and counties in Virginia at risk of receiving additional disbursements from that defendant. And so one of the things that we're trying to do with the Opioid Abatement Authority is encourage all the cities, all the counties to, instead of trying to figure out the exact rules for each one of these settlements, just follow our gold standard. We've come up with a gold standard that exceeds all the settlement requirements from all the different companies. And if you follow our gold standard, then you don't have to worry about defending yourself in court. We'll be right there alongside you, along with the Attorney General's office. We'll be right there to support you. We'll be right alongside you the whole way because you're doing what we told you should do. And if you'll agree to do that, we'll increase the amount of money that we're making available to you by 25%. And I'll get to that in a little bit more detail in just a minute. One good thing is that no matter which settlement we're talking about, they all have the same attachment, which is called Exhibit E. And all around the country, people are getting to know what this term Exhibit E means. It's a list of approved uses. And those approved uses are the same for all the settlements. Okay. So what's the gold standard look like in Virginia? In Virginia, 100% of the money you get from us, and what we recommend you do for all the opioid money you're getting, is every penny of it has to be spent on opioid abatement remediation efforts. And I'm happy to talk in more detail about what that means, but basically anything that you do that helps to provide awareness, education, prevention, harm reduction, treatment, any kind of treatment, any kind of like acceptable treatment source for people with opioid use disorder, recovery supports, case management, the whole 9 yards for people that have opioid use disorder and co-occurring mental illness and co-occurring addiction. So if you're dealing with a family and there's a question about guardianship and whether or not it's a safe home, a safe family, and you've got a parent that's using multiple different substances, as long as you can create a nexus to opioids somewhere in there, then the program that you're trying to implement to get that person, to get that parent clean and keep the family together would qualify as an approved use of the funds. So it doesn't have to be 100% opioid treatment. It can be getting somebody into a treatment program who's at high risk of becoming an opioid addict, or who is using multiple substances, or who is in recovery from opioid use and other substances. Then we're not splitting hairs on that. This is really, there's no such thing as someone who's just an opioid addict anymore, because of the way all these others, the stimulants, the cocaine, the meth, and everything else is almost, if it's not being cut with an opioid like fentanyl, then it's at high risk of being cut with an opioid like fentanyl. And so it's pretty easy to demonstrate that what you're doing has a linkage to opioid abatement remediation. What we can't do is use the money to fill potholes or to buy fire trucks, or, that's what we're trying to guard against. And there's localities that we're talking about using these monies to balance their general fund budget, and that's what we're trying to guard against. One of the other 3 standards is that, there's no supplanting in this. So you can't use the opioid money to replace local general fund money that was being used for the same purpose. Now, if you were getting money from an unstable revenue source, like a federal grant that's getting ready to expire, then we have to look at those on a case-by-case basis, but we understand. And if you have a revenue source that's getting ready to sunset or expire, and you want to apply opioid money for it from us, then let us look at that, and we'll try to give you the green light to do exactly that. We'll document it so that there's ever any challenge in the future that you'll be in the clear. We don't allow indirect charges, and if you have and there's a difference between indirect and administrative. Administrative charges are allowed if they are necessary to create and run the program, okay? But you have to be able to define what they are. You can't say, well, we're going to take 10% off the top or 2% off the top. That's not allowed under the code. You have to be very clear in accounting for what those administrative costs are. Ms. Blackwell is raising her hand.
I am. Thank you so much. So I have a question, kind of related to the supplanting, comment. So we have a lot of youth, in our jurisdiction that are impacted by opioids as well, and we're seeing that increase. And so our CSA funds, a lot of those funds are being spent to support youth who, you know, have substance use needs, et cetera. Would that be considered supplanting if we were to kind of, you know, we're thinking about our increased costs related to CSA and then the abatement funds. Could we use the abatement funds for that, or they would have to be kind of a different, you know, source, or that would be considered supplanting?
What we would need is a kind of a written out request from you of exactly what it is that you're looking to do, and maybe some budget information, and we'll be happy to talk with you directly, like offline, about that. And then we review it with our representative from the Attorney General's office, because, you know, I'm not an attorney. We have to make sure that it's in the clear. But generally speaking, CSA dollars are appropriated by the local board of supervisors. And so if they're looking to free up CSA existing appropriations of CSA dollars to pay for something else, then that unfortunately probably would be supplanting. What we're talking about is unstable revenue sources that you're at risk of losing completely, as opposed to reallocating. Reallocating really kind of would be a supplanting issue. But I'm happy to have that conversation with you separately, and we can look at the details of it.
Sounds good, but your response is clear. I appreciate it. Thank you.
Great, thank you. So no supplanting, no indirect, basically no arbitrary administrative percentage charges. And then there are reporting requirements. You know, the shadow of the Tobacco Commission looms large over us, and there's this perception that a lot of that money was wasted. And so there's a lot of watchdogs. At the top of the list is the General Assembly. They want to know how the funds are being spent. And so the gold standard is to carefully track your expenditures and to use performance measures to demonstrate what the result of the expenditures were, and then share those with us. Now, if the performance measures don't show, like a performance measure could show that the program's not working well, but that's okay. I mean, that's good information, because that gives us the chance to maybe make improvements. So it's the reporting of the data that is the critical part. Let me just explain the gold standard incentive a little more. Basically, with the money that goes directly to the cities and counties, if your city or county will treat this part of the funds that they have access to, if they'll treat the money that comes directly to them the same way that we require money that's available from us to you, if they'll treat it the same way, then we'll increase the amount that we're holding for you by 25%. And then we pay for it out of our unrestricted budget. All right, so let me shift gears a little bit and tell you a little bit about the money that we have available. So Opioid Abatement Authority has money set aside. 15% of our fund is set aside for programs to cities and counties, individual cities and counties. So each city in Virginia, each county in Virginia has a fixed amount of money that they're entitled to receive for opioid abatement remediation purposes. We're holding that money for you. In order to receive it, you just have to fill out an application and tell us what it is that you want to do with the money. And we're not evaluating, the only thing we're evaluating is whether it meets the criteria. So it's a pass-fail application. We will not come back to you and say, look, this is an eligible use, but we think there's other things that you should be doing with it. It's not a competitive thing. This is, you apply, you've got the money in the bank, and what you want to do is an allowable use. We approve it, we cut the check. It's that simple. All right, all we're doing is guarding the money to make sure that it's being used for allowable purposes, non-competitive. And in a moment, when I'm done with the PowerPoint, I can show you on our website where to find how much money your locality has quote unquote, in the bank from us. Now, if you don't apply for the money in the fiscal year that we're holding it, we'll carry it over to the next year. And if you don't apply for it the next year, we'll carry over again. And so the question is, well, how long will we keep carrying it over for you? Well, we haven't decided that yet. We're going on our third year, and we still have most cities and counties have not applied for their money. So we're holding fiscal year 22 money. Here we are in fiscal year 24, and we're still holding money from 2 fiscal years ago for localities. At some point, we're going to have to tell you that, some of that's going to start to have to be put back into the till. So anyway, 15% of our fund is your money that we're not going to give to anybody else. It's not competitive. 35% of our fund is available on a competitive basis. But in order to apply for a competitive grant, you have to partner with at least one other jurisdiction, a city or a county, doesn't matter. But it can be a city, it can be one city and one county. It can be 11 counties. It can be any combination, but there has to be at least 2 jurisdictions combined, and at least 2 of the jurisdictions have to be in the same state Department of Behavioral Health region. So the DBHDS regions, there's 5 of them in the state. And there's planning regions are different than social service regions, are different than DBHDS regions. So we have all this information on our website, but the law says they have to be in this, at least 2 of the entities that are applying together have to be in the same DBHDS region. And so you can compete for these regional grants. And this is money that's over and above what we're holding for you. Okay. And then we have this unrestricted fund that gives our board the ability to go over and above these percentages. So if the project that you present to us would put us over budget in one of these areas, our board can decide to go ahead and pull money out of their rainy day fund to pay for it. And we've been doing that. So I thought it might be helpful to kind of summarize what we've done so far. We've only been in business for a little over a year. We've done 1 round of grants to cities and counties, and that was last summer. And when we did, we awarded $23 million. There were a total of 76 cities and counties that participated either individually or as part of a cooperative partnership grant. Only 13 cities or counties applied for individual grants. So only 13 cities or counties applied for these funds here. 26 cities and there are 26 partnerships that involved multiple jurisdictions that applied for these competitive funds. Okay. So that's why obviously 13 and 26 don't add up to 76. And it's because these 26 partnerships included different numbers of cities and counties. Hopefully I'm not losing you guys here, blowing your mind. When we give you a grant, we give you the money up front. It's not a reimbursement based model. There's some nuanced exceptions to that. Generally, when it comes to conditions that have to be met before we give you the money. So for example, if the condition is that you're going to do an RFP for a contractor to come in and work with you, we're going to wait and see what your actual pricing comes back. Because you're not going to know on an RFP, you don't know what the cost is going to be until you have a chance to make it a contract award. So if it's all based on awarding a contract, then we're going to wait and see what the actual contract award is, and then we'll give you the money to cover it. For the most part, once we approve a project, then we want to work with you to try to make sure that it can live for a few years, up to 5 years, because we know how hard it is to hire staff on a grant-funded program where the funding's only good for 1 year. So we want to give you a little bit more runway than just 1 year. Having said that, we can only provide the actual legally appropriated award for 1 year, but we can agree on a 5-year plan. So some examples of some individual grants that we gave to cities and counties. The city of Hampton is getting $60,000 from us and they're adding additional money to this from their own general fund, but it's going to result in a program to have a peer-led drop-in center for crisis. They're going to have a jail-based medication program for people with opioid use disorder. Roanoke City is providing ACEs training for a variety of their staff, the city staff, adverse childhood experiences training. They're providing a peer recovery specialist in their jail to screen people on intake. They're providing xylazine test strips, and they're distributing Narcan. And then Chesterfield County received an individual grant to put together a plan to build and operate a 24-hour behavioral health facility. Some examples of the cooperative partnerships. So this is where localities came together and competed against each other for cooperative funds. Albemarle County is the fiscal agent for the group that you see here around the Charlottesville area, and they're mainly focusing on crisis intervention expansion. And so they got 2 different grants that come to almost $1.3 million in funding. Campbell County got Campbell County's is a one-time award because it's all capital. It's to contribute to the renovation and opening of a crisis receiving center. So this is all construction renovation money. So this is an example of a program that is not a 5-year program, it's a 1-year program. In the Spotsylvania, Fredericksburg area, Stafford County is the fiscal agent for a mobile medication unit, and they're going to expand detox services in partnership with a local recovery center. Fairfax County is leading all of the large Northern Virginia localities to build and create a residential treatment center for adolescents. This will be the first publicly funded program of its type in the Commonwealth of Virginia. And they're contributing, they're pouring all their opioid money into it from all these localities, and we're matching it with a $3.6 million award in the current fiscal year. At the other end of the state, in the deep Southwest Virginia, Grayson County is a fiscal agent, along with the city of Galax and with Carroll County, for $260,000 program to build on their recovery court. And so there's just to give you an idea of just sort of the width and scope and variation of projects that we're funding. In the Montgomery County area, we've got about 5 localities listed here, but there's actually more like 13 total that are involved. They're just not all signatories on the grant application. This is almost a $3.5 million grant per year to help them build out a recovery ecosystem that reaches everything, sort of a broad program that includes prevention, treatment, education, transportation for clients, recovery court investments, recovery housing, the whole 9 yards. It's a really fantastic project. Again, Smith County, Bland, Carroll, Grayson, Wythe counties, and City of Galax, $1 million for recovery housing, medication, and regional transition recovery housing. In the Richmond area, Henrico County's fiscal agent for a $100,000 planning grant to evaluate gaps that exist for pregnant women who have opioid use and other substance use disorders. This program really is aimed at keeping these pregnant women out of the criminal justice system, which I think is an example of where this could cross over into social services and dealing with family issues. All right, so just some observations that we've had about the applications we've received so far. Again, it was the first round, so we expected we'd need to come back and make some modifications. The first one is sustainability, because even though we've got a lot of money coming to Virginia, when you divide it over 133 cities and counties and spread it out over 18 years, it goes quick. And so if there's an idea about creating a new program and bringing on staff to support it, and particularly if the cost of the program is going to grow over time, the Opioid Abatement Authority cannot be your permanent funding source going into the future. The idea is to use these funds to make a splash and to kickstart an effort and to get things going in a community. But long term, you have to think about how these programs are going to be sustained. And when we look at a multi-year budget, what we're looking for is that the first year should be the most expensive. And then each year after that, what we're contributing should go down each year as the locality finds other ways to support the program. Or perhaps the program is designed to sunset once the OAA funding is no longer available. Now, we would love to fund these programs in perpetuity, but unlike the tobacco settlement, where they have revenue based on tobacco sales forever, we don't. This is a one-time shot of money, and once it's gone, it's gone. And so if you think about a program that you want to fund, think about how you're going to assume responsibility for that program over time through other grants, through local funding, what have you. One of the things that we've seen is that service providers that are out there have filled out the application and then gotten the city or the county to sign it. So we've had examples of community service boards writing the application and then taking it to the county administrator of one of the counties that they serve and getting them to sign it and to serve as a fiscal agent. We've seen the same thing from both nonprofits and private providers. I don't know that this really applies to social services agencies because as I understand it, you're all pretty much part of the structure of existing cities and counties, and you're used to working through that structure. But I think it's still true that if you're willing to do the heavy lifting in terms of writing the grant application, researching it, coming up with a budget, and then running it up the flagpole for the city or the county to approve it, then that might be an option as you're going through the budget process. There's a lot to be done for us to help Virginia's 133 cities and counties participate. We've had less than 50% of our cities and counties have applied for a grant. Now, our goal is that we want to have grants going to every single city and county in Virginia. Well, our goal is to save lives, but the vehicle for that is by working with our cities and counties to make it happen. As I mentioned, and I'll be a little bit more brief on this one, we also provide grants to state agencies. We provided funding to 16 different state agencies, and the total amount was 11 million. We were really pleased that we were able to spread those funds across all parts of state government, including executive branch agencies, the judiciary, colleges and universities, and independent agencies. And those grants are providing a really wide range of programs that are designed to fight the opioid crisis statewide. And so probably of close interest to you guys is a small grant this year of $205,500 to DSS to help them get off the ground an idea that they have of creating basically a fund that they can use to provide additional funding on a competitive basis to local DSS offices for kinship care, kinship navigation programs. So the idea is that they'll use our money to stand up their own grant program to benefit local DSS offices that want to, expand kinship navigation, case management for people in the kinship care side of placing kids. As you can tell, I'm not a social services person, but I have I think there's an enormous unstated value in a lot of the discussions about the use of the opioid money fails to talk about foster care and about placement of kids whose parents are not available for whatever reason related to opioids. And I think we have a ton of opportunity here. So I'm trying to encourage you guys to participate in these grants.
Hey, Tony,
Yeah.
can I ask a quick question about the VDSS grant?
Please. Real
quick on Kinship Navigator. So, because that's one of the ideas we have, we're not going to be one of the targeted populations for the state's Kinship Navigator. So we're talking about what it would look like to go after Kinship Navigator as a locality. It doesn't sound like their grant is with their program, their money is requested in the same way that we would be requesting it. Is that correct? If they're looking to just fund grants that are grant opportunities?
I think that what's my understanding of the way this is going to work with them is they're going to use the money we're getting this year to build out the structure of this program. It's not, $205,000 is not enough to fund a kinship care navigation program across, even on a limited basis across the state. All right, it's enough to kind of get the idea up off the ground. That's about it. But Gretchen, you could do a combined approach. You could use some Henrico County money. You could apply to the OAA for some funding, and you can combine that with some of the funds from DSS. And they haven't released their guidance yet, so I can't speak specifically to the guidance on it yet. But just to understand that, I think the key point is that if you wanted to hire someone to come in and do kinship care navigation, that is absolutely an allowable use of these funds, and we want to work with you to get there. Whether you're applying entirely to the OAA or you're trying to combine it with some other revenues, we want to try to help you get to that point.
And the key for us is that we would just have to show how we're going to be able to sustain it after your financial assistance.
Correct.
Thank you so much.
Absolutely. Just some other programs we've done with state agencies. DMAS, which is the Virginia Medicaid, is going to be launching what we call a bridge program. This is where hospitals have a formalized program to get people connected to treatment before they discharge them from the emergency room. We're trying to expand that. The Virginia Indigent Defense Commission. So this is the state agency that supports public defenders for cities and counties that have public defenders, and provides funding for them to enter into a partnership with a nonprofit called Recovery Corps to put case managers, basically peers, to serve in a sense as case managers into the public defender's offices to help people that in the criminal justice system find a way to navigate their way through the system and avoid incarceration and get into treatment and stay in treatment. And so again, could really be beneficial if we're talking about somebody who potentially could regain custody of their child by staying on the right path rather than going to jail. And so that's what that grant is going to do. That's actually a really cool grant because we're only spending $225,000 on it, but it's allowing us to download millions of dollars from Recovery Corps at the national level to embed these people into these offices across the Commonwealth. Bradford University's getting some funds to expand their collegiate recovery program. University of Virginia is launching a street medicine program for opioids. The Office of the Attorney General is doing a statewide awareness campaign on One Pill Can Kill. DOE is working with the Virginia Foundation of Healthy Youth and Virginia Tech Cooperative Extension Service. They're combining all their resources in these programs for a little over $2 million total to launch a comprehensive youth prevention program in schools and in other youth settings across the Commonwealth. VDH is getting a little under $3 million to expand naloxone distribution, expand harm reduction efforts, and to add some opioid positions in 3 of the local health districts. Department of Behavioral Health is getting a little over $500,000 to provide an educational curriculum for judges, attorneys, and other officers of the court, and to advance a second recovery high school. You guys may be aware that there's only one recovery high school in Virginia. It's in the Central Virginia area, and so this would help DBHDS identify potential locations for a second recovery high school. And then we're doing a bunch of different projects with Department of Corrections focusing on treatment of inmates with opioid use disorder. I even suggested to DOC that we need to start comparing notes with DSS and see in what cases do we have parents whose kids are in the foster care system where a parent is in the state prison system, and see whether that parent who's in DOC could be a candidate for a special treatment program to try to get them restored to being able to act as a guardian for their kids. I'm going to switch in just a second to our website, but just to let you know, we've published all the grant applications that we received during the first round. We published the applications that were submitted. We've published our analysis that we gave to our board. We do an analysis of every grant and we submit recommendations to our board. And then we've published the actual award amount with the budget and everything. So you can see what every one of these applications look like. And if you're like me, if you're going to fill out an application, I like to have an example of one that was successful that I can copy in the process. And all that's on our website. I'll show you that in just a second. The application period is open right now. It's open until April 1st. If you're applying for your individual money, the money we're holding on your behalf, we award those on a rolling basis as they come in. You don't have to wait until April 1st. But the ones that are competitive, where you have multiple localities competing together, because they're competitive, we wait until the end of the grant application period to decide on those. And so you have until April 1st to fill out these applications. This is the standard application cycle. It's October 1st to April 1st each year. It's designed to allow you to basically have a decision in place before your city or county fiscal year starts so that the awards come at about the same time that you get your new fiscal year appropriation. And then we do state agencies on a slightly different cycle because we have to work around the state agency, the internal state budget cycle. We did do something that we're pretty proud of, this Abatement Academy series. It was a series of 14 live webinars that we did in cooperation with Jennifer Nelson and the Virginia Institute for Government. All 14 of these were recorded and are on our website. We've had over between people that were registered to watch them and views. They're all on YouTube. Over 3,000 impressions so far from these programs. They're all really designed to give you examples of programs that can be done in Virginia using these funds. And I'll show you that. Oh, and jumped ahead too far. Opioid Abatement Authority won a big national award, so tooting our own horn there for a moment, provided by Johns Hopkins University and a group of 60 national organizations across the country dealing with behavioral health and substance use. And there's my contact information. As soon as this webinar is finished, I'm going to send this PowerPoint to Jennifer, and she's then going to email it to every person that was registered to be a part of this session. So you'll have all this information.
And
I'm going to-
I'll be sending that in a couple of days when our video folks get a chance to translate this to YouTube video.
I'm going to try at this point to switch gears a little bit. And do you guys see a Google screen now?
Yep.
Okay, great. All you have to do to get to our website is type in V as in Virginia, OAA.us, and that'll navigate you to our website. And just to show you a couple things, if you click on Grants Portal and then scroll underneath Resources and General Information, if you scroll down, here's that link I was telling you about. The application, supporting documents, and summary recommendations from our initial grant cycle. So if you click on that, then you can see the cooperative partnership grants, the individual city and county, and the planning grants that we awarded. Back to the home page, if you click on Media and choose Documents, all the way down at the bottom where it says Resource for Cities and Counties, the link that says City and County Estimated Settlement Payments Lookup Tool, this is an Excel file. And it should allow you to open it. Here we go. Sorry, folks, I'm just getting ready to share this screen with you. This is what the lookup tool looks like. And by clicking on that link, you open up the lookup tool. Now, Gretchen asked a couple questions, so I'm going to type in, I'm going to go down to Henrico. So every city and county is in here. Click on Henrico, and it shows you the green. This is the amount that has been paid. Let me back up. We're on this table, we're only showing you the results of the settlements that have been fully executed. All right. And we're only about halfway there. So the money you see on this table, you're going to see a lot more money coming into this table as more settlements are finalized. Okay. But this is what we know of already has been finalized and confirmed. So in fiscal year 22, Henrico received just under $182,000 directly from the settlements. Last fiscal year, they received $1,151,000 directly from the settlements. The current fiscal year, they should be getting $246,000 from the settlements. Okay. The blue shows how much Henrico County is eligible to apply for from the OAA. This is the money where it says this column is eligible to receive. This is the money we're holding for Henrico. And now this column is how much we've actually awarded to them. Now, in some cases, it's not award for an individual project, but instead they ask to use these funds as a local match for one of the competitive grants. And so this is how much they've used or put forward as a match. And then this is how much is their available balance. This is how much we've got in the bank for him. Right now, Henrico County's got a little under $430,000 sitting in the Opioid Abatement Authority Bank, ready to be awarded. And then next year, we'll have at least $87,000 available for them. Now, if they wanted to apply for the gold standard, that's what's listed in this green area. And so again, as Walmart comes through, as Walgreens, these other companies, as those settlements come through, all of these numbers you're gonna see the numbers increase for each of the future fiscal years. Okay? And we can do this for any jurisdiction that's out there. I'll just randomly choose one. Here's Lee County. Same thing. It shows what their projected current or projected direct distributions, how much we're holding for them, and what their gold standard incentive would be. All right. Going back to the website. I'm back to the website again. If you click on Abatement Academy, this shows all the different sessions that we did, the title of the session, who the presenter was, and then if you're interested, you just click on watch the video, and it pops right up. And again, there's 14 of those from last year, and some pretty cool topics here, and some really good information if you're interested. We will be doing more of these in 2024, but we're taking a breather right at the moment and coming up with the schedule. So stay tuned for more information on that. So at this point, I'm going to stop sharing my screen and ask what kind of questions folks in the audience have. Hopefully I didn't leave you completely confused.
I'm sure everybody's coming up with different ideas running through their minds right now.
I have a question. This is Courtney Tierney from Prince William County. Can you explain one more time about that gold standard thing?
Sure. So each city in each county in Virginia has a certain amount of money that they're entitled to receive from the Virginia Opioid Abatement Authority. And we'll increase that amount that you're eligible to receive by 25%. If your county will voluntarily become a gold standard county. And all that means is that all the money that Prince William County gets, whether it's from us or directly from the settlements, if Prince William County is willing to treat all that money according to the OAA's gold standard rules, then we'll increase the amount of money that we're holding on your behalf by 25%. So it's just critical to remember that every city and every county is getting opioid settlement monies from 2 locations. You're getting it directly from the companies that settle. It's going to literally being wire transferred from those companies to your treasury. All right. It doesn't flow through the state budget at all. And each county and each city is responsible for spending those funds in accordance with the settlement agreement. Okay. The other place you can get money is from us. If you get money from us, you have to follow our rules. Our rules are stricter than the settlement agreement rules. But if you apply our rules to the settlement money, then we'll give you even more of our money. That's it in a nutshell. Does that make sense?
Yes, that last piece was very helpful. Thank you.
And even though basically what it means is a county like Prince William would basically, if they say we want the gold standard, what they're saying is they agree to spend the money for opioid abatement and to not supplant and to be very transparent about it. And in return, the OAA is going to give you more money. The OAA will help defend you in any court action that the defendants might bring forward. And it really, quite honestly, is going to make it easier for you to track the money because you track it all the same instead of have to track each settlement differently.
Okay. Great, thank you.
Any other questions?
So
Okay.
if there aren't questions now, I'm sure that some of you guys probably have questions in your mind. Please don't hesitate to call, to email. Our whole job is to help you be successful. This is all we think about. It's all we do every day. We would love to see more grant applications come in that target DSS efforts, whether it's case management, if it's referrals for services, whether it's anything, whether it's kinship navigation for in cases where parents are, struggling with substance use disorders. We want to be part of that solution. This is, I think anybody that's paying attention to what's going on with the opioid crisis, probably the best indicator of how much harm's been done to our country is by looking at what's happened with foster care and with kids being taken care of in the kinship care program. The chairman of our board Senator Todd Pilligan is a dentist in Abingdon, Virginia, which is about as far and south in Virginia as you can get. He's a dentist down there. And he told me that almost all his patients, he's a pediatric dentist, and it seems like almost all his patients are being brought in by grandparents, aunts, uncles, extended family members, and because that area has just been devastated. The statistic I read is that nationwide since 2010, there's been a 500% increase in foster care placement. And so I can't think of a more worthy place for us to make a difference than in the work that you guys do. And I know that a lot of times it means partnering with your service providers like your CSBs or your courts. But the way we're structured, we're all about funding those kinds of multi-department efforts. And so if you have an idea and you want to just chat about it, please send me a note. We'll be happy to set up a separate call, separate webinar with you and your team and anybody that you'd like to bring to the call.
Hey, Tony, it's Gretchen, and I had the benefit of sitting in on your presentation at the League conference, and I just loved it so much. I'm back again. But one of the things, and I had to step away for 3 minutes or so, and you may have already spoken to this, but one of the things I really recall from the last presentation is the offer that you made to sort of assist and talk us through the process. Just if we, as we're going through it step by step, sort of looking at things and helping sort of guide language we're using and stuff like that. If you could just sort of reiterate that, because I think that is something that's sort of overwhelming as a local social services worker, thinking about, that creative writing skill that may not come as comfortably.
Yeah, if you want to take a crayon and start scribbling ideas about an application and share it with us, and what we don't want to do is we don't want to write your grant application for you from scratch. But if you give us something, anything to work with, we'll hold your hand and walk you through the grant writing, the grant application process. We'll be there with you every step of the way. Now, it's not often that an organization that provides grants will offer to help you write the grant, but that's exactly what I'm offering to do. We're all here to serve the same customer. And as a state, we're not going to be successful unless we collaborate. So do not hesitate to share ideas, drafts of a grant application. If something in there doesn't make sense, like if you don't know how to answer a question, please shoot an email to me or call. My email, the presentation you just saw has all my contact information on it, and you're going to be getting that by email shortly. I will say that I'm getting ready to go out of town with my wife for a little while, but I'll be monitoring my email, and somebody from our team will follow up. Our goal is to respond to every inquiry within 8 business hours or on the same day that it was received. And so we're here from the state and we're here to help, which is something you don't hear very often, but we mean it. But
thank you. I just want to
bureau-
make sure everybody heard that as openly as I had heard it
No,
before.
I appreciate that. We don't believe in bureaucracy here. We want to, we come to work every day intending to kick butt by helping you guys do what you do really well. We know that you're the ones that are on the front line talking to the families, and we want to help you get more money to bring on staff, to create programs, to connect with service providers, and to give you resources to offer these families. Hopefully that's coming across as clear as I hope that it does.
Yeah, thank you, Tony. Just wanted to say thank you. And if anybody on the call today has ways that we can engage the rest of our membership or ideas about some projects, maybe we could get some presentations from some of these folks who are implementing projects in the next year or so. And Tony, hope that you will join us again at a league event this year. Probably ask you back for November if that's all right with you. And
hey, so I don't have the particulars of it, but I do know that James City County was looking to hire, I believe it was a kinship care navigator,
yeah,
and they're using their direct opioid. They didn't apply for a grant from us, not yet. They're using the James City County's direct money to do that, which is why I don't have a lot of details on it. But
here's Barb Watson, from director of James City.
there she is. Yeah.
Hi. Yeah, we use some of our money to hire a it's almost like a opioid case manager. and she has been working with pregnant moms. And so, and then we are talking with some of our community partners about the community project, how collaboratively, what that project is that we're going to apply for money. So you should be seeing an application very shortly.
Well, thank you, Barb, for letting us kind of put you on the spot there. Appreciate that. All right, folks. Well, thank you very much for your time. Jennifer, do we have anything else from the VIG perspective to share with folks?
Nope, just look for the follow-up email probably sometime midweek. And it will have the contact information for folks at the Opioid Abatement Authority, and I'll give just the general info email, Tony, to give you a little break while you're on vacation, and this presentation, and we'll get this money for you so you guys can do some great things in the Commonwealth.
And we're recording this session, and Jennifer, we're going to share that link with everybody, right?
Yes, sir.
Okay, perfect.
All right. Thank you, everyone. Take care.